Good morning, Sarah.
Hey, Erin, good morning.
I am so glad to be able to spend this time talking with you about a project we got to do together. So everybody watching, I'm Erin Brash. I'm the Executive Director for WNC Health Network, and we had the pleasure of supporting Public Health Region 1 in developing their public health workforce plan. And we know that it's been put to use, and there's been some interest across the state and how you did this. And so just wanted to spend some time today talking about that project. Before we launch in, Sarah, will you tell us a little bit about who you are and your role with Public Health Region 1 and the kind of things you do day to day?
Sure. Yeah, my name is Sarah Tennyson. I'm the Workforce Development Director for Region 1 Health Departments. So the Region 1 Health Departments, it goes over from Cherokee County to Haywood, Transylvania. So it's 8 counties in the far west. As the Workforce Development Director, I'm technical assistant to each of the health departments, especially when it comes to recruiting and retaining staff. After COVID, we had a 46%, actually 46% of our public health staff left after COVID. And so this position was created to help kind of fill those gaps of figuring out ways to support our existing workforce and recruit our workforce coming into public health.
Wonderful. So shifting to talk about this specific project that we worked on together, can you give us a little bit of background about it?
Yeah, so the way that this project worked was the health departments received a grant. It was the ARPA grant, so it's the American Rescue Plan Act funding. And so, after COVID happened, like I was mentioning, there was just it was an exodus of the public health staff. And so with this funding, it was really to help us fill some gaps in the foundational capabilities of public health. And so the way that we did this is there was quite a bit of data that was collected. We interviewed staff from health departments across the state to see, what do you need in your position? What kind of training, technical assistance, support do you need in your day-to-day life and in the health department? So we got a lot of information back from our staff to figure out ways to help support them. So we heard directly from the people that are most affected. But as happens with public health money, oftentimes we get the funding. We have such a short turnaround of how we're going to spend that money. And so we have to make some very quick decisions. And so this is just kind of how we operate in public health. And so what we thought as the Region 1 health departments is that we needed to, we had a limited amount of money, we had a limited time frame, and so we needed to be very smart with our money in terms of making longer sustainable impacts, because we didn't want to have just a short, we had this money, we wanted to make it last. So what we wanted to do was to come up with a strategic plan to help guide us over the next 5 years, to make sure we were making informed decisions and the smartest decisions for the region. And so we decided that a strategic plan would be the way to help us get there. And we've worked with the health network over the years to do things like this. And my experience with the health network is that when we have kind of a complex issue, we have a variety of different agencies with different agendas, different priorities, different capacity. Is that we needed to be able to bring an external partner in. And so the health network was a good fit for this kind of thing, to come in, bring all these different diverse people, personalities, agendas together in a short amount of time, to be able to kind of synthesize a plan for us to be able to follow over the next 5 years. And so that was kind of what got us to the point to want to develop a formal plan.
Yeah. And remind us who was all at the table? When you say who was involved in coming up with the plan?
It was the Region 1 health departments. And so it was each of the health directors from the county. So that would be Cherokee, Clay, Graham, Macon, Swain, Jackson, Haywood, and Transylvania. and myself. And actually it is nice. And part of the thing is, we think about, it's like, oh, I could possibly facilitate this. But what I find so nice is having kind of an external neutral party that comes in, because that helps me as the director of the program participate in the process as well. And also to kind of have that external support. So it's a kind of a neutral party that's able to come in to help facilitate the process. So that I find is really nice to have someone like you all to come in to help do that.
Thank you, Sarah. We certainly appreciate the depth in which you participate, right? So one of our values when we provide this kind of support is co-design, so that we know that we're uniquely meeting the need. So you had a very clear vision of what needed to happen, and it was exciting to be able to support you in that.
I just wanted to add, and part, because I was thinking about the answer to this question ahead of time, and part of it is, Emily Kajawa was the facilitator along with you, which was really nice. But Emily and I, before that session, we had many meetings ahead of time, and so I think that's really important distinction. It's like, while that meeting, I was kind of like a neutral person, but ahead of time, her and I really did co-design that together, the process, the questions, the product. And so I really appreciate that aspect, because I was right there with the process ahead of time, during and after. But then the day of, it was like I could kind of step back. And so that's just an important distinction. So I appreciate you bringing that up.
So now that this project happened a good while ago, what's going on with the plan?
Well, it's been really nice because, in public health, oftentimes funding is what we sometimes call braided funding, because it's never straightforward. It's rarely straightforward. Oftentimes we have an issue or, something we're trying to address, and we have to kind of figure out ways to make it work. And so one thing I will mention about the Region 1 health departments is they're very resilient. They're used to working together. They're used to, well, I guess we, are used to working together. We're used to taking a small amount of money, kind of expanding it, finding other ways to fund certain projects, build the capacity for something. And so what we've been able to do is take that plan and approach different funders and apply for different grant funding streams, where, okay, so we've prioritized certain pieces of this workforce plan, so I can apply to a certain funder for something that would fit appropriately what that funder is looking for, where we're also getting other funds for the state, so we can kind of piece together what we're able to fund from different sources. And so I've used that plan multiple times over the last year, and it's so nice to just have this nice tangible product that really supports my work and leveraging additional funds. And so it helps me be successful for the region. So it's really nice to have that.
Sure. You mentioned the state, and I'm curious what the response has been in other parts of the state to your plan, or from the state itself.
Yeah, we've gotten a lot of really positive feedback from other regions and the state. And the reason why is because we knew that these funds would end in May of 2024. We were prepared for that. So we did this plan last year, kind of anticipating we would have like a year left. And so, I think when grants wrap up, a lot of times it's like, oh, sustainability, what are we going to do next? And so I kind of feel like our region was kind of ahead of the curve, because we had already kind of gone through this process. We already had these pieces in place. And so across the state, I had been sharing about our process to my counterparts in other regions in the state. And so they were very curious what we did. So they often, would reach out to me to say, how did you do this? What questions did you ask? What was your process? Can we see the plan? And so I got a lot of really nice feedback from other regions across the state, kind of wanting to replicate or, get some feedback on how they could do something similar.
Great, Sarah. Well, we certainly enjoyed working with you on this project. Thank you for, as always, for being a great partner with us.
Yeah, it was awesome. Thank you so much for helping us. It's been really, really wonderful.